Hello, this is a presentation regarding ASD and ADHD resource dissemination. The organization I work with is known as the ADHD and Autism Support. It is a company based in Seattle, Washington. They are focused on trauma-focused therapy for individuals with ADHD and autism. This organization is based in 636 East Lake Mead Washington Boulevard, Seattle, Washington, 98112. Phone number 425-534-5233. The program consists of group meetings every other week. The meetings provide individuals the space to explore the impacts of ADHD and autism and grow social and emotional skills. The program also utilizes a number of advocacy strategies and initiatives such as self-advocacy and self-determination. The focus is on empowering individuals to understand and communicate their own needs and rights. This is achieved through structured educational programs that teach communication, self-awareness, and decision-making skills, fostering greater independence and quality of life. The strength-based approaches. ADHD advocacy often highlights the positive traits associated with ADHD, such as creativity and enthusiasm, to reduce stigma and promote acceptance as part of neurodiversity. Policy and legislative advocacy. The program advocates for comprehensive health insurance coverage, including mental health and behavioral sciences services, and work to reduce financial and systemic barriers to care. They support policies that expand Medicaid, stabilize insurance marketplaces, and ensure that telehealth services are accessible. The assessment tools used by this program, first of all, the assessment tools for adults with autism autism spectrum disorder. The first tool is the Autism Diagnostic Observation Schedule, second edition. The ATOS tool is considered the gold standard for diagnosing ASD in adults. Module 4 is specifically designed for older adults, older adolescents and adults with fluent language. It involves structured and semi-structured tasks to observe social communication and restricted behaviors. The Ritvo Autism Asperger Diagnostic Scale Revised Test. The RAADS-R is a self-administered questionnaire and is designed for adults 16 and above to assess the presence of autism spectrum traits. Functioning Assessment Short Test, acronym FAST. The FAST is used to assess functional impairment in adults with level 1 ASD, showing good reliability and validity in differentiating levels of psychosocial functioning. Assessment tools for adults with ADHD. Symptom and executive function assessment. Conners Adult ADHD Rating Scale. acronym CAARS, CARS. CARS is widely used in educational and clinical settings to assess ADHD symptoms, including inattention and hyperactivity impulsivity. It includes both self and observer-reported versions. The Adult ADHD Self-Report Scale, ASRS. The ASRS is a brief, easy-to-administer tool that measures ADHD symptoms, severity across various domains of functioning aligned with DSM criteria. Brown Attention Deficit Disorder Scale, acronym BADS. BADS focuses on executive function impairments, which are particularly relevant in educational and vocational contexts. Pragmatic Skills Assessment. This tool evaluates pragmatic language and communication skills, which can impact educational and professional performance in adults with ADHD. The evidence-based practice, which this program uses is the cognitive behavioral therapy and behavioral interventions. CBT helps individuals recognize and change unhelpful patterns of thinking and behavior. For adults with ASD and ADHD, CBT is often adapted to address challenges such as anxiety, emotional regulation, organization, and social skills. Behavioral interventions involve teaching individuals to monitor their behaviors, set goals, and use rewards to reinforce positive behaviors. For example, adults might learn to break tasks into smaller steps, use checklists, or implement time management strategies. Why this approach is evidence-based? Scientific support. CBT and behavioral interventions have been shown through peer-reviewed research to be effective for adults with ASD and ADHD. These approaches are recommended because they have demonstrated positive outcomes in managing symptoms and improving daily functioning. Adaptability. These interventions can be tailored to the individual's needs, focusing on skills that are most relevant to their personal, educational, or vocational goals. Skills development. CBT and behavioral strategies help adults develop coping mechanisms, improve executive functioning, and enhance social and workplace skills. Now, how the program outcomes affects micro, meso, and macro systems. The microsystem impact, individual outcomes. The program can lead to improved self-regulation, social skills, executive functioning, and mental health for adults with ASD and ADHD. This can result in greater independence, higher self-esteem, and better quality of life. Direct support. Professionals working closely with the individual may find their work rewarding and effective as the adult demonstrates progress and increased engagement. Mesosystem impact. Workplace integration. Adults with ASD and ADHD who participate in this program may show improved job performance, better communication, and increased retention in employment. Community participation. Enhanced social and adaptive skills can lead to greater involvement in community activities, peer groups, and social networks, reducing isolation and promoting belonging. Macrosystem impact. Policy and advocacy. Positive outcomes from such programs can inform policymakers about the effectiveness of interventions, leading to increased funding, improved service delivery, and the development of inclusive policies for neurodiverse adults. Societal attitudes. As more adults with ASD and ADHD succeed in various life domains, public awareness and acceptance of neurodiversity can grow, reducing stigma and promoting social justice. Here comes the end of my presentation.